Dr. Quick, what everyone wants to know is what is your solution for the political chaos that we're in right now? It's not much different than in Albert Camus' The Plague. How do you extricate yourself from the political chaos to end with a better medical outcome?
Well, I think the first thing is that we need to keep persisting in getting the public, everybody, to see the reality in front of us and to do what works. We're sitting here in the U.S. seeing explosive increases, with at least 30 of the states seeing increases, yet we look around the world and we see what works. I think we've had the worst of pandemic communication in the sense that we have our leaders not on a common message, and that's part of it. And I think right now, we're on base with the Rockefeller Foundation. We're working to build an alliance of public organizations to get a consistent message out to the public about the virus is here. And so if the leaders aren't coming together, I think society has to come together. But keep pushing the leaders with facing the reality. We've got this pandemic. We know it will be with us for a while, and we know what to do to slow it down.
Your work included 6 years with the World Health Organization. You are a good filter of all the literature that is out there. If we see the case count explode in Florida to Arizona, do you just correlate that over to a rising death count in the coming weeks?
Well, yes, with the recognition that the shift early in the outbreak, it was really a lot of at-risk older people. We weren't protecting the most vulnerable. So we're seeing now cases rise, but the death count at the present time is holding steady. So we will see more deaths. We will see proportionally fewer because more of the cases are younger people who don't die as often. But yes, indeed, we will see rises in death count as the increase now most in the youth filters up to the middle age and older. So yeah, I expect we will see the death count coming back up.
Dr. Quick, this distinction is so important, this idea that you're seeing the case count rise exponentially in some areas, but the death count not expected to rise as much and not rising significantly at this point. Could this be interpreted as perhaps these flare-ups not being as dangerous as the initial ones and being just another sign of a reopening economy, young people getting back into the workforce and managing through the virus to get some sort of herd immunity without necessarily a vaccine on the horizon for the next couple of months?
Well, I mean, honestly, I think that's wishful thinking in the sense that is a bigger outbreak, even if proportionally more of it is in the youth, it's still going to claim lives. The virus hasn't changed, and I think one reality is it's not saving lives or saving the economy. That's a false choice. We can do both. But our biggest failure has been not to really reinforce those basic personal protective behaviors which we know work. Distancing, face masks, hand washing, avoid large gatherings. I think there's an in-between where staying indoors for 3 months didn't change the virus. It's still just as contagious. And whether you start with a youth epidemic because they're not following enough these personal protective behaviors, it will eventually continue and affect the whole population. So we do have to reopen, but we have to do it in a way which really applies the lessons of what has worked in other countries to plateau at least the virus and minimize and reduce the deaths and all of the knock-on effects.
Dr. Quick, how long do you think it'll be until we have a vaccine?
Well, I have to say I'm encouraged by the vaccine work that's going on now, because we have at least nearly 20 vaccines in human trials, and that's exciting. And we've got a couple that are going into the AstraZeneca University of Oxford one and the Moderna one. Both of those are going into to the last phase of human trials, where we really go on a large scale to test the safety and efficacy. So I'm encouraged. That said, the whole process of scaling up production and all, I think we'll start seeing some coming out in the spring, as folks hope, but I don't see large-scale vaccine availability that changes things fundamentally until the latter half of 2021, as folks have been saying since the beginning. I think that hasn't changed, but I do think the speed has been historic, and the companies are really looking at how to maximize production.